Are you facing a bone marrow biopsy and feeling a little unsure about what to expect? It is perfectly normal to have questions about medical procedures, especially those that sound a bit complex. Let me walk you through it so you feel more prepared and at ease. A bone marrow biopsy is a common and important procedure where a small sample of your bone marrow, usually from your hip bone, is collected for examination. This sample helps doctors understand your blood cell production and identify certain conditions like lymphoma, providing crucial information for diagnosis and treatment planning. The primary reason for performing a bone marrow biopsy is to get a detailed look at your blood-making factory inside your bones. Unlike a simple blood draw, which checks mature blood cells circulating in your veins, a biopsy examines the immature cells and the marrow environment where blood cells are born and develop. This provides vital insights into conditions that might not be visible from just a peripheral blood test, helping pinpoint issues like cancerous cells or other blood disorders. The procedure typically starts with you lying on your stomach or side. First, the doctor will clean the skin over your hip bone, specifically the posterior iliac crest, with an antiseptic solution. Next, they will inject a local anesthetic to thoroughly numb the area, similar to what you might receive at the dentist. You might feel a brief sting or burning sensation during this injection. Once the area is numb, a small incision, usually just a few millimeters long, is made in the skin. Then, the doctor uses a special hollow needle to access the bone. They will gently twist and push the needle through the bone's outer layer to reach the soft, spongy marrow inside. You might feel a sensation of pressure or dull aching during this part, even though the skin is numb. Once the needle is in place, a syringe is attached, and a small amount of liquid bone marrow is drawn out. This is called a bone marrow aspirate. You might experience a sharp, brief pulling or suction sensation as the aspirate is collected. After that, the needle is slightly advanced to take a small core sample of the solid bone marrow tissue, which feels like more pressure. Once both samples are collected, the needle is removed, and pressure is applied to the site to stop any bleeding. Finally, a sterile dressing is placed over the area. Knowing these steps helps demystify the experience and highlights the precision involved. Your healthcare team is always there to guide you, explain each step, and ensure your comfort. Remember to communicate any discomfort you feel during the procedure, as additional anesthetic can often be provided. Understanding this detailed process means you are an informed participant in your own care, leading to a smoother and less anxious experience. Ultimately, this procedure provides critical information that empowers your medical team to make the most accurate diagnosis and develop the most effective treatment strategy for your specific situation. Being well informed about each step can significantly reduce any anxiety you might feel, allowing you to focus on the positive outcomes that this important diagnostic tool helps achieve for your health journey.